Hi there. It might come as a surprise that in therapy, we actually utilize theories as a guiding practice for the interventions that we use. One of these theories is called EMDR, which stands for Eye Movement Desensitization and Reprocessing. It's a type of therapy that's been around for quite some time, but over the last few years, it seems to me as though it has gained in popularity. Let's just talk a little bit about what EMDR looks like and what you can expect from it. One more time, the acronym stands for Eye Movement Desensitization and Reprocessing. The way that I typically describe it to folks who reach out looking for it is that it really is a technique where the therapist will help you to utilize eye movements to desensitize the body's response to triggering events, and then we reprocess some negative belief patterns that we may have. I just wanted to give a little bit of an informational video on what to expect in EMDR therapy. Perhaps the biggest and most important thing to expect when you come to therapy is that we don't start eye movements right away, but we're still doing EMDR. EMDR is an 8-phase treatment, and in the first phase, it is literally titled History Taking. So when you show up for your first session of EMDR therapy, you can expect that there will be a fair amount of questions that comes from the therapist. Now, some of these questions may feel stressful and some of them may feel unimportant or even insignificant. But the reality is what we are looking for are specific belief patterns that the client may hold about themselves, and then memory networks that kind of reinforce that negative belief. Once we have all of that, then we jump into the preparation phase. In this phase, you can expect a fair bit of some talk therapy and exploring what types of skills might be helpful in regulating emotions. In phase 2, we may even start doing some eye movements, but we're not necessarily reprocessing anything from the past or even current triggers. At this point, we're learning to teach the body to manage its emotions in an effective manner. Moving on from there, what you can expect is your therapist helping you identify specific belief patterns that might be contributing to uncomfortable emotions. This is where we start the desensitization process. What this looks like can come in a few different forms. When I was trained, it was initially suggested that utilizing eye movements was the most effective way of doing EMDR therapy. And the idea was utilizing eye movements in order to help us recognize negative belief patterns as well as uncomfortable emotions. We often do this by identifying a trigger that happened within the past week, or even as we process trauma, we go back in time identifying memories. So what you can expect in this situation is that your therapist may actually move their chair a little bit closer to you and sit off-centered, and then we'll utilize eye movements. It's also important to note that in phases like this, where we begin reprocessing, there's not a whole lot of verbal exchange. There's not a whole lot of counseling or advice giving, or even potentially a lot of validation that comes from the therapist. At this point in time, we're using the eye movements so that the brain of the client can learn new belief patterns. So don't expect in this particular type of therapy that there be a lot of validation during the reprocessing phases. Don't expect that the therapist make a whole lot of comments during these reprocessing phases. It's actually quite scripted. Some of us may even pull out the script to make sure that we're correctly on track as we should be. One thing to keep in mind is that for some people, eye movements may not be the most effective. So often we will use tappers or even have the client tap themselves alternatively, whether it's on shoulders or legs. The idea is to get a bilateral stimulation going. So in EMDR therapy, you can expect that there will be some eye movements. You can expect that there might not be specific comments or validation that the therapist may make, but that more it's focused on the brain and the body responding. Once that desensitization phase has happened, then we work on installing new belief patterns and creating future templates to where we might be able to handle a trigger more effectively. So, EMDR therapy is a great opportunity for us to rewire our memory networks, to recreate new ways and new systems of learning. And I think that this is one of the things that is most helpful in figuring out how to manage our emotions effectively. If you have interest in learning more about EMDR or even further questions about it, here at Healing Connections Counseling, we'd be happy to talk to you and even provide some consultation. Thanks very much and have a great day.